one and all. I, Anne Louisa from first year MSW, take this privilege to welcome you all for this second day of the webinar, Scope and Challenges of Women Migrant Workers Post COVID-19 Pandemic, organized by PG and Research Department of Social Work, Sacred Heart College, Tirupattur, and funded by National Commission for Women, New Delhi. I now request Dr. C. Christy Anandan Sir to address the gathering.
Good afternoon to all. It is my pleasure to welcome you all at this gathering. My dear organizing team, resource persons, and participants of the program. We have this pleasure and hosting this particular program, this webinar on scope and challenges of women migrant workers in the post-COVID-19 pandemic. Yesterday, starting with the welcome address of Reverend Dr. John Alex, Secretary, Sacred College Society, to the special address from resource persons, we had an enlightenment of the reality picture on the hardships of the women migrant laborers. As we listened to them about various types of problems and challenges faced by the women migrant laborers, it is also very important that we should understand the efforts and strategies to mitigate these problems. As poverty have forced many of these families to migrate and earn their livelihood, but the same condition is taken as an advantage by the capitalists to exploit these people. Therefore, it is our duty to intervene with the right strategy to protect the rights of these migrant laborers, especially the women. I'm having the pleasure of welcoming Reverend Father Andrews Raja, Head of the Department, PG and Research Department of Social Work, Sacred College. The eminent speakers of the day, Ms. Padmapriya, Ms. Lata Munuswamy, and Dr. Soumya Shankar, to this webinar to enlighten us. And as participants, I welcome you all to take an active participation. Yet I also would like to make an important note on the efforts of Dr. K. Arakiraj in organizing this program. We appreciate him for bringing us together with apt titles and suitable speakers to enlighten us. I welcome you all to listen to the eminent speakers of the day for greater insights. Thank you all. Welcome you all.
Thank you, sir, for extending a warm welcome. I now request Father Henry Daniel Ambrose to introduce our speaker for the third session.
Good afternoon, one and all. I'm extremely happy to introduce Ms. Padmapriya. She has over 20 years of experience in top management roles of leading international development organizations such as CARE, Save the Children UK, University of Washington ITech, and the British Council, to name a few. Prior to her current role, she was the country director of Good afternoon, one and all. Am I audible?
You are audible.
Yes. I'm happy to welcome and introduce Ms. Padmapriya. She has over 20 years of experience in top management roles of leading international development organizations such as CARE, Save the Children UK, University of Washington, ITech, and British Council, to name a few. Prior to her current role, she was the country director of Labara Foundation, the philanthropic arm of Labara Telecom in the UK. Padmapriya has specialized in strategic planning, operations management, grants and budgets management, policy development, and internal controls for the non-profit sector. She is an associate member of the Institute of Cost and Management, Accounts of India, and holds master's degree in commerce as well as business administration, with specialization in human resources from the University of Madras. She also holds executive certification in global health management from the University of Washington, USA, Executive Certification in Change Management from Indian Institute of Management, Kolkata, and Strategic HR Management from Loyola Institute of Business Administration. She is also a trained social return on investment practitioner from Social Value, UK. She has extensive experience in recruiting, training, and working on governance boards. Padmapriya has been awarded the Rotary Vocational Service Excellence Award in 2014. She is among the top heritage bloggers of India and is a heritage researcher, walk curator, speaker, and published author. We welcome you, ma'am, for this afternoon session.
Thank you. Thank you so much. Good afternoon, everyone. At the outset, I would like to thank Sacred Heart College, Tirupattur, and Dr. Aragiraj for inviting me this afternoon to be part of this very esteemed gathering. The young development professionals in the making. So this topic that we have been discussing since yesterday is something of imminent importance because the lockdown, we all would agree, has thrown our regular lives and livelihoods out of gear. But then, if we were to look and apply the same rule to the female migrant workers, it has made their life much more difficult to manage. So I'm sure you've been hearing all about this from yesterday. The topics are interrelated and they're likely to be overlaps. So please bear with me if I'm speaking the same things that you have already heard yesterday. Unfortunately, due to prior professional commitments, I could not join the discussions yesterday. But then I truly feel there's nothing wrong in repeating those things that we have already spoken about yesterday, because these things need to be ingrained in our consciousness if we have to make a very conscious effort to make a change in the lives of these people and to advocate for their rights and privileges. So if we are ready, with no further ado, I will move into the presentation. Right. So the first topic for today is the role of NGOs and industries in sustaining the wellness of women migrant workers post-COVID-19. So the role of NGOs and industries. Now, this is something that we have to very closely observe. It's a very good topic, and I'm really thankful that I got to speak about this, because the NGOs kind of serve as the bridge in connecting industries. On one hand, the industries have the legal and the statutory responsibilities to take care and sustain the wellness of the women migrant workers. The migrant workers, on the other hand, have the role of working in making these industries achieve their outputs and their profit targets. And it's the NGOs, the civil society, which kind of brings these two together to make sure that it is a complete harmonious circle. Now, some points that I wanted to kind of place before you before we move into the other details of the presentation is, in India, as far as 2020 was concerned, there were 140 million migrant workers, not a small number at all by any yardstick. And more than half of this 140 million, so more than 70 million of those migrant workers are women. And from this 70 million workforce, there are 57.4% that migrate after marriage. So migration is not something that by choice as far as women are concerned. In majority of the conditions, there are several studies that have been undertaken in India which show that the major reason of migration as far as women laborers are concerned is marriage. So they move from probably the father's field to the father-in-law's field to be an agricultural laborer, from an industrial setting in one town or city or village or whatever, semi-urban area to another area purely by choice of marriage. They could be working in structured or in non-structured settings. So in an organized sector or in an unorganized sector. And one point that we often tend to ignore, because whenever we speak on migrant female laborers, we are often talking only about those workers that are working on daily wages or working in unorganized sector. We also have to keep in mind that there are several of them who migrate after education to take up jobs in other cities, could be in the IT sector, could be in the telecom sector, FMCG sector. So we also must not forget about this group of migrant female workers who may not be in the bottom consumption quintile. Right. Now to move forward. Yeah. So if you look at what is the percentage that the women migrant workforce is in the total workforce of different sectors. I just spoke about the rural and urban sectors where we find the female migrant workers. So you see in the primary sector, 75% and 65% is women. Manufacturing 59 and 51. Public services 69 and 56. Construction 73 and 67. Traditional services 65 and 55. And modern services 66% and 52%. So overall, we have in the rural sector 73%, urban sector about 56, and then the average out to be a little over half of the total migrant population in India. So this is as per the 2007-8 NSS survey. Of course, the figures have since changed because the data that we saw in the previous slide was of current or of recent origin from 2020. But nonetheless, it does not reduce the importance or significance of women in every sector that is there to consider as far as India is concerned. You can see the comparative figures for men, and then you will see that why it is so important that we are talking about the subject that we are talking about currently. Right. So all economists, everyone agrees that migration is crucial for economic development, because otherwise, development would be concentrated to certain cities or certain areas in the country. And for all-round development, all-round growth, all-round economic, growth, we need to have migration. But then, what does this mean for women? What are the risks and challenges that women face? I know that there has been a session fully focused on this yesterday, so I'm not going to go into explaining each point that are there on the slides, but I most definitely want to touch upon them, because there could be something there that probably would trigger thoughts in your own mind, because I'm pretty positive that your your discussions or your thoughts or even your informal kind of communication within your group is not going to stop with this evening. I'm sure there would be at least a few of you who would want to take these discussions forward and probably come up with some action steps on how you in your own small way will be able to address this particular issue. So as I mentioned, yes, so they don't have any choice. They migrate post marriage and take up whatever livelihood is available for them in their husband's or the spouse's location. Very often they are the invisible working class, because people who are, as I said, working in agricultural fields that belong to their families, who are providing labor in sole proprietary concerns or family concerns that are run by the spouses, the entire domestic, the workers, the housemaids, the caregivers, the cooks, all these people, are mostly women, but very often they remain an invisible working class. They do not come into the forefront. They don't have an association or forum which kind of, represents their collective bargaining or, advocates for their rights and privileges. Most of them work in the unorganized sector, as we all know. The difference between contractors and agents in a variety of ways. I thought, it's important for us to discuss this, because a contractor is somebody, like most organizations today do not want to take the responsibility of providing the statutory obligations for their support staff. So most of the people who have the lower rung of the organization are often outsourced through a contractor. So you would have the housekeeping staff, you would have the cleaning staff, you would have the pantry staff, the security guards, other support staff that are required in an organization are most often today outsourced through contractors. So what do these contractors do? They would collect the payroll or the wages on behalf of this employee. They would take care of their social security obligations and then pay them the money that is due to them. So at any given point of time, the contractor is the person who is accountable to sustain the well-being of these workers based on the money that he or she receives from the organization. But then who would be an agent? An agent is someone who would merely recruit these migrant female workers for an industry, and then he has nothing to do with them. So he would probably go and talk on behalf of the industry. You must have heard of the Sumangali scheme. I have probably spoken about it yesterday, something that has been eradicated on paper, where these agents used to go to households and tell the mothers that if they sent their daughters to the textile mills to work for 3 years, 5 years, at the end of the period, they would get a sizable sum of money, which would be adequate to get these girls married. So mothers who did not have any other option of getting their girl children married, parents would agree to this, and so a small amount or a lump sum amount would be given to them in the beginning, and after which they would go there and they have to accept whatever wages or whatever living conditions or working conditions are offered to them. So this is something that we also have to keep in mind while we are discussing migrant workers. And then, most of the time for the migrant female workers, there are unregulated work conditions and pay. I see a hand raised, but can I request questions to be held till the end of the session, because I'm conscious we only have 30 minutes for the presentation. At the end of the session, I would most definitely be happy to answer any questions that the audience might have, as long as my knowledge and experience is concerned. In case there's a question that I'm unable to answer, I'd most definitely refer and come back and send you an email on it. I hope that's okay and I can continue. Right. So unregulated work conditions and pay, mostly in the unorganized sectors, there are no minimum wages, there are no stipulated working hours, there is no overtime if the person works longer than normal 8-hour period or a 10-hour period. They have to work probably all 7 days of the week and so on. Mostly, I would say almost everyone does not have any access to government schemes or social benefits. The most important or significant challenge that these women face is they don't even know what are their rights and privileges. Almost complete lack of awareness about their rights and privileges, unless these NGOs kind of come there and then work with these people and educating them about their rights and privileges. There could be unscrupulous agents who are exploiting these women by saying, every day you hear about international migrant laborers who are taken to other countries, and then there they are recruited as housemaids and cooks, but then they are trafficked. We keep reading about this all the time, which leads into the next point that has been mentioned there. And then, of course, the bonded labor, entrapped in debt and bondage. So very often, if they have no other choice of a livelihood, or they are in debt and they need to settle the debt, these women agree to be in bondage and they go and like in the bricklin industry, and the government has taken a lot of steps to relieve them out of this bondage and then make them live a normal free life. Poor and unsafe working and living conditions, I don't have to explain this, I'm sure all of us are aware. Low wages and very long working hours. Basically, they do not have a life outside of the industry in which they are associated in, because they live in the dormitories, they work till whatever time, till dinner time, and then they just go and sleep. So low wages and very long working hours. Several occupational hazards and health and safety challenges dependent on the industry in which they are associated. As I said, if they are in potential forced or bonded labor, there is even lack of freedom of movement for them. They can't even go back and visit their families or travel outside of the setting that they are kind of restricted to. There is possibility of violence, there is possibility of harassment, sexual abuse at workplace. We keep reading about all these things on different occasions. Lack of nutrition, because they hardly get nutritious meals. They have to eat whatever is served to them in the canteens. Very often these may not be nutritious, so they could result in their anemia and other health conditions for them. They could not be allowed to participate in civic responsibilities like voting because they do not have any enumeration in the city where they are working. And as the government schemes has been repeated, so very often they are not part of government schemes. We do not have any reliable data about all the female migrant workers other than census and NSS, which is not something that is constantly updated. There isn't any data which is all encompassing of all the industries and of all the women in different nature of jobs in these industries. Domestic workers, we have already spoken about this, totally outside the gambit of any data, any regulatory or welfare activities. And very often industries take the statutory thresholds as an excuse to provide benefits to the migrant workers. For example, for maternity, there is a threshold of 50 workers in an organization. Social security benefits, 10 workers. So what they would mostly do is not take 10 people on payroll, keep them all as weekly paid or daily paid, so that they don't have to provide all these benefits to them, which is very, very difficult and completely discriminatory against women. Now, on one hand, we have spoke in the last two slides about what are all the situations on the ground for which industries or the middlemen or the environment might be to blame, or in many reasons the laborers themselves could be the reason to blame. But what is the welfare state? What is the government doing in this case? So rather than completely resolve these issues and appreciate and take on women as a very significant workforce which needs to be protected and their well-being to be sustained across the board, sadly, we are in a situation that we haven't yet reached there. The added woes of a legislation gap, when you look at a definition of an interstate migrant worker, according to the Interstate Migrant Workers Act of 1979, you would find that it defines it as a person who's recruited by or through a contractor in one state, or it could even be an within intrastate as well, under an agreement or any other arrangement for employment in an establishment in another state, whether with or without the knowledge of the principal employer in relation to such establishment. So as I mentioned earlier, contractors kind of come under the law to a certain extent, but completely agents are not at all considered. Now, with or without the knowledge of the principal employer in relation to such employment kind of also lets the employer go scot-free, because tomorrow there is a problem, the agent is not going to take responsibility. The employer need not necessarily take responsibility. And so that particular migrant laborer is completely defenseless in that case. There is absolutely no mention of women or any special preferences in the act at all, other than the maternity benefits that are mentioned. There is completely no mention of women or any special preferences. Of course, equal work and equal pay is mentioned, but then we all know, and so I am not going to be elaborating on that. The other sad thing is that the role of inspectors, ideally the inspectors should be the ones who should be tasked with sustaining the well-being in these industries. They should be the paid authorities by the government to make sure that the industries are providing whatever welfare benefits that are required for the female migrant workers. However, the role of inspectors is only reduced to compliance and facilitation. So they just go there, and if the industry is not doing something, all that the inspectors will do is fine them for that particular thing. They would only, so it's only a question of either facilitation or they only have to fine them for statutory compliance. There is no way that these people can enforce the well-being to be maintained or sustained. And then, the legislation has not implemented vital point like compulsory registration of every single migrant at the destination location and linking them up with all the government welfare schemes. This is still very loose, and although after October last year the registration is available online, the kind of supporting documents that a worker needs to be registered are very, very difficult to obtain. So, and obviously they're not going to lose wages, go and stand in the line. If they are not able to do it online, they have to actually go and wait in line to get registered. So all these are things that are not practical or customer friendly for the migrant workers. Okay, this is a screenshot that I have taken from the National Commission for Women website, which lists the laws that are currently available in India relating to women. So you would see that there is an Immoral Trafficking Prevention Act, there is a Dowry Prevention Act, there is an Indecent Representation of Women Prohibition Act, Sati, Protection of Women from Domestic Violence, Sexual Harassment at Workplace, Criminal Law, Indian Penal Code, Indian Evidence Act. Now, other than the POSH Committee Act, which is the Sexual Harassment of Women at Workplace, there isn't anything related to workers in the workplace. Everything else is more relevant to, their home setting. And there's nothing related to migrant female workers. So you can well appreciate the fact that as to why it is really significant and important that something specific is legislated, something specific is kind of brought about that talks about female migrant workers and all their rights and privileges and compulsory registrations. And NCW has also been speaking about this, but I just thought I'll also show this perspective to you as we speak. Again, this is the Labor Department of Tamil Nadu's website, and the drop-down menu that you see on your screen is the statistics that are available in the website. And you can see it's about strikes and lockout, disputes and various claims and appeals. Again, no statistics on the actual number of female migrant workers or anything that is specifically pertinent to women. So nowhere is the women workforce seen or shown separately, and the statistics being kind of put there on the public domain. So this again, as I said, calls for action, and as NGOs, as advocates of this particular cause and issue, this is something for us to be working with the government and bringing their attention to. So which are the industries where migrant female laborers predominantly work? And I would say all industries, but however, based on statistics that are available, the list that you see on your screen are the industries where they are mostly working. So like agriculture, textiles, construction and bricklines, IT and call centers, healthcare, retail, beauty parlor and other service industries, restaurants, hotels, domestic health, and small vendors. So this is based upon the statistics that are there, and then of course they are there everywhere. So this is not a restrictive list, but more of a indicative list. Right. Now we come to the specific point of discussion. So far we have been talking about general challenges, general legal environment, general industrial environment where these migrant workers are operating. Now, if we have to look at the specific issue of the COVID pandemic, what did we see? We saw the huge exodus of female migrant workers of various sectors who went back to their hometowns with their families. At the same time, we also saw a huge inflow of frontline workers to the cities or to the places where there was a high incidence of COVID-19. So as far as healthcare workers, police personnel, sanitary workers, all these people were drawn from different parts of the states to the places where there was a high incidence of COVID. So there was also an exodus and there was an inflow. And there was also a third scenario, which I have not put in this slide, but it comes in another slide, wherein you would find that there were people, there were single migrant laborers who stayed wherever they were staying. They did not go back, nor did they kind of, accompany families. Those were individuals who were working alone and staying in hostels or staying in dormitories and working in the cities. They did not go back. So that was another aspect also which needed to be considered. So you would find that overall fall in labor, and this is not pertinent to just migrant laborers, this is overall fall in labor across India, came down from 400 million in March 2020 to 280 million in April 2020. So if this has been the case for the whole of India, you can well imagine how it has affected the migrant worker situations. In November 2020, 13% of women are neither in the workforce nor are they looking for a job. Again, this is all India, all laborers statistics. Right. So now, since our topic is about NGOs and industries, now what did the NGOs do during COVID-19? They helped in transportation of the migrant workers. Although there was a Supreme Court ruling that everything should be free and the migrant workers should be given buses and trains should be available to take them back without fares, the initial exodus in kind of panic was chaotic, and it was only the NGOs that worked with the migrant workers in ensuring a safe transportation to their home locations. They gave them food, they gave them relief materials, both while on transit and also after they had reached their locations. And whoever was left behind was also cared for by the NGOs during the lockdown period. Again, they gave them masks, they gave them other, sanitizers, those things were all provided. We as Sanitation First, the organization that I head, were working through the COVID pandemic with the migrant workers in providing, wash services in the various locations, in the corona wards in government hospitals. We provided in wherever they had been quarantined, the places where they were staying, all these places we gave wash services to them, like, portable toilets, hand wash stations, contactless hand wash stations, hygiene material, all that was provided to them. So apart from this, the NGOs also supported those who were affected by COVID. So if a person was affected by COVID, they took care of the persons, taking them to the hospital for testing, taking them for admissions and other things, supporting their families in whatever requirements they needed. If the key person, the earning member, was away in the hospital, in case somebody passed on, they helped with the cremation. They also supported deliveries. We would have seen a lot of videos and news about pregnant women who were delivering on the way as they were going back to their hometowns. And they also helped when there were cases of domestic and sexual abuse, which rampantly increased during the lockdown period. Okay, so what happened to these migrant workers who went back to their residences? First of all, they lost food security, because while they were in their location where they were working, at least if the industries were not providing them food, they had some kind of surety of livelihood whereby they could provide for themselves, but that was lost. NCRB, the National Crime Report Bureau, mentioned that there was a 600% increase in domestic violence. Now, this is something that, the number is absolutely alarming, 600% increase. And this was not just in the, it was not just restricted to the villages or restricted to the lower quadrant of the economy, but it was rampant across the board. The women were forced to accept poor work conditions and meager wages. Now, what happened was immediately the agents got in touch with them, gave them some advance amount to block their time to collect them back once the lockdown got over. They had no option but to accept this, and then they had to go back. Else, whatever work was available in the place where they were stationed, they had to accept those poor work conditions and whatever meager wages were available to them. Complete disruption in routine healthcare and reproductive health services, because they had no access to any of this. They lost the childcare support in Anganwadis, which they got in the places where they were working, because most of the Anganwadis were closed. They did not get nutrition for the children because schools were closed. It took some time for schools to give the rations, but before that, there was quite a chunk of time where the midday meals were not available. One problem we found across the board, because we work in WASH, was there was a huge scarcity of menstrual hygiene products, because girls used to get the napkins in school and women used to have some money to purchase these napkins. Most of them had to go back to cloth because they didn't have the money to do this. They had a challenge to keep children in school because all the government schools were closed. There was no online education. They had to take up a compromise in the housing and water sanitation conditions. There was no employment, no training. They could not come back immediately. Even now, only about 30% of the employees have returned and taken up the jobs. The remaining are still struggling. There was no financial resources to resume business. The one huge portion of the migrant workers were people who came to the cities or came to the nearby towns, and they were small vendors who were selling, they were roadside vendors, or they had small shops, pavement shops. These people did not even have the working capital available to them to resume their business and continue their business. There was distress sale of assets, there was loans, there were debts, and not to say alcoholism. In fact, alcoholism, I want to linger on that for a moment. Yes, the liquor shops were closed across the board. And then at one point where, this alcohol was being sold in black market in different places, once the shops opened in certain locations, I think Chennai, where I live, was the last place where the wine shops were opened. And during that time, because the traffic was closed in most of the roads in Madras, the leveling of potholes and then the repairing of stormwater drains and all was going on. And it was really difficult for them to get laborers, because most of the workers, what they would do, women and men both, would go all the way up to Tiruvallur, where the wine shops would be open. So they would take the Annakuda or the the Parambakuda and go on two-wheelers with their sons or husband or brother or somebody. And then the women would stand in the queue in the wine shops and collect all the bottles, because apparently they had a preference in the lines, like how you would go see in a cinema theater in the previous days, where if a woman went and stood in the counter, then she would be allowed to collect the tickets, even if the men are waiting. So the women used this privilege to collect the bottles, brought them back, and sold them at twice, thrice, even 4 times the cost. So this gave them money to kind of keep their families running. So they were not willing to take up any other employment, which would have probably given them less money. So in a way, because of these shortcuts and because the money that came through it, alcoholism continued to flow, which led to the increase in domestic violence. Now, what about the people who are working from home? As I said, not everybody was a laborer who went back and tried to find labor. There were many people who had to go back to their home settings and work from home. And what happened to them? The first thing was an increase in health issues. So the women, there was this big study where it spoke about a large number of women coming up with health issues because they did not have the money to buy LPG, or they probably did not have LPG back in their hometowns, where they went back and they had gone back to resorting to firewood, and so they had breathing difficulties and so on. Complete collapse of work-life balance. And this is something irrespective of whether they are in the city or in the village, migrant worker or otherwise. Every single woman has experienced this in the lockdown period. And in case there are women in the group who have been going through this, I'm sure they would appreciate, because the entire family is working from home. And so apart from your working from home, you also have to manage taking care of their requirements and needs right from the morning till the night. And so there's complete collapse of work-life balance. There's been an increase in the expenditure in working. So previously, you would go into an office and work, wherein other than your transportation expenses and food expenses, there won't be any expenses in the working itself. Whereas here, you have to either get data on your phone, or you have to get an internet connection, or you have to, get your larger telephone bill. So all these things, which not every case is paying for, there has been a higher expenditure in working. Increase in domestic violence and abuse, we have already seen. For people who are working from home, the migrant laborers, no baby care or senior care support is available. So they have to juggle that as well. Studies show that the domestic responsibilities have gone up from 5.3 hours a day when prior to the lockdown to 6.79 hours per day. On paper, it will look just like an increase of a little over an hour and a half. But then if you had to look at it from the stress levels and the physical exertion levels that the women have to go through, you would find, you would understand how it could kind of, affect their mental health and well-being, or even their physical health. Inability to support the online education of the children. So even for those people whose children were, studying in private schools, if they went back to their home locations, there they could probably be suffering from lack of bandwidth. They would not have multiple phones, multiple computers. You would see used laptops that were being sold at 3,000 and 4,000 rupees, Windows XP processor laptops from 10 years or 8 years old, those were being sold at 20,000 and 25,000, and people were even pledging their thalis to buy that for their children so that the children could continue with their online education in schools. And then, of course, forced to participate in additional labor activities, whatever was their family occupation, other than continuing their work, whatever they were working from home, whatever their day jobs were. They also had to support the families, because now they went back to their in-laws or to their parents, where they were already carrying out agriculture or any other family occupation, and these people had to participate in that as well. Now, I said, we never saw when the huge exodus happened on TV, on newspapers, even when we physically saw people moving in groups to their hometowns, there were very few single women who went back to their families. Now, there could be multiple reasons for this. Probably the families felt it was not safe for the girls to go back all by themselves, so they stayed with friends, they stayed with colleagues, or they kind of hung out with whatever was available to them. And what happened to these people was they had to work longer working hours with a huge cut in salaries. Even now, this has not come back up. Even in IT companies, this happened, where most people had to take cuts in salaries. Mainly in FMCGs, people who are working in the service industries, they had to accept whatever task was available to them, or whatever was the rate in which they were rehired. They missed out on all the COVID-19 relief schemes, because at least people who went back were given, dry rations, were given 1,000 rupees in case they were a registered migrant worker. Now, these people did not get that as well because they didn't go back. The living expenditure definitely had gone up. All of us know what were the prices of vegetables, or even the other expenses, how high they had become during and immediately after the lockdown. They had to live wherever it was possible for them to live with the means that they had. The stress levels and the mental well-being was definitely affected, because one, they hadn't seen their families in a very long time. Second is they had all these compromises that was piling upon them. And home-based migrant workers. Now, this is another complete, people who are doing piece jobs, or people who are doing kind of in the agarbatti rolling, or handicrafts, people who used to kind of stitch certain pieces and give it back in bulk. All these people during lockdown and after lockdown, they had to work for 8 to 10 hours, and they were only getting paid something like 10 or 15 rupees a day, which you can completely agree that they would have absolutely not been adequate for them to take care of any expenses. Now, the fourth type of female migrant worker category are those people who were frontline workers, the inbound migrants who came to those places where there was a rampant increase in the COVID-19 cases. So you would see from the statistics that are available that 70% of frontline workers and 88.9% of nurses are women. So what happened to them? They had to work very long working hours. There was a huge inflow of patients in all the hospitals, be it government hospitals or be it private hospitals. Long shifts, very insensitive working conditions, because they had to wear the PPE kits for 8 hours or 10 hours, within which they would be sweating. They could not, because of the mask, you would have seen a lot of pictures on social media about marks that they had on their faces because of the N95 mask pressing on their skin. Menstruating women, hygiene and menstruation would have been a huge challenge for the frontline workers, because they would not have an opportunity to remove the PPE kit and change their napkins, which means they were bleeding into their napkins for 8 to 10 hours at a stretch, which would affect them psychologically and also physically, and gave them a lot of health issues because of that. People were dying on their hands every day. So you watch a person dying in the road as you're passing by, that affects you for 3-4 days. Now, what would have happened to these people who were to see, like, cases being brought in every day where people were dying? So that itself was affecting their mental health, and there was absolutely no time or opportunity for them to be counseled. There were several occupational health hazards, like PPE kits were not available mainly to sanitation workers. Insurance was not available to everyone across the board. So, talk about every single hazard that is there. The frontline workers were going through that. poor pay in many sectors. They were getting very poor pay, like sanitation, because people were brought from everywhere, and these guys were deployed in making that tagaram and sealing up all the houses if a person was detected with COVID, putting the bleaching powder. In fact, we used to give food and tea and money to the health workers who were working here, because they are mostly very poorly paid, and they had to work around the clock because every street had cases that they had to go and attend to. They had to get their food, they had to get them whatever they required at home. So it was like a thankless situation. They had to stay wherever they were given housing. There were doctors and nurses who stayed in their vehicles for 10 to 15 days because they couldn't go back to their families, nor was there a space available in the dormitories for them to stay. The most significant challenge that was faced by these people was stigma and discrimination. The house owners were asking them to vacate because they were working with COVID patients. Doctors and nurses did not have neighbors coming and playing with their children because they were affected, that they thought that they would be affected by COVID. So many ways in which stigma and discrimination affected them. So all these challenges had to be faced by these people. Now, what was happening behind the scenes? A lot of things we have already touched upon, so I will go quickly through this. Single migrant women, as I had mentioned in the previous slide, who stayed back had to face a lot of challenges. Industries, when after May, when the industry started opening up in phases, what they did was, the first batch of people that they hired was the able-bodied young women. They did not take the older women, they did not take women with responsibilities, health conditions, because they felt this younger group of women could work for as long as it was required, and they could work at any pay that was offered to them, because the families would be fine with that and the women would be fine with that. Also, when the SOPs were released, the mandate that allowed longer working hours with employee consent, it's a completely misguiding concept, because what is employee consent? I mean, in these situations where the people are dependent on their survival for the money that they get from their jobs, the employee consent actually means nothing. They do not have the liberty or the freedom of choice and have to go with whatever is available. Particularly women. Women are the caregivers. Women are the guardians of the entire family, and anything that will bring food to the table for their parents or for the spouse or for the children, they would be happy doing that, even if it means sacrificing their own well-being in the process. As I had mentioned earlier, the agents had already booked the migrant workers by giving them advances, which was useful to them during the lockdown period, but made them bound to go and accept whatever work conditions were available to them. So efforts definitely were on behind the scenes to keep women trapped in the vicious circle of bonded labor. Although, in good times, the government has been working very hard. Organizations and NGOs have been advocating against this in a very strong manner. Mental health and well-being, we all agree, was thrown out of the window. And as I mentioned, women were more gullible to accept longer hours to stay in the jobs for their families. So what is the gap in the policy framework? None of the labor laws, as I had mentioned, have specific provisions for female migrant workers, no official statistics. SOPs did not have any guidelines or criteria for the migrant workers because although migrant workers were in the radar of every media channel, every newspaper for the best part of the lockdown. Despite that, when the SOPs came for reopening of industries, absolutely no guidelines or criteria for migrant workers. The registration process, once the people were coming back to take up their jobs, it is not friendly at all, because if they have to go and register in the police station, it is like, in Tamil we would say kaasu koduthu sooniyam, because one women would not be comfortable to go to a police station to register themselves, and this would be like, even otherwise migrants are pulled up for any crime that happens in that area, and this would be like they themselves are kind of adding to it. So if a friendly registration process for migrants was done, where they could probably go to the panchayat or go to the local body and then register themselves, or to a welfare department and register themselves, then that is something that they would be able to do. And domestic help, we really don't know. There were households where people paid their domestic help wages and asked them to stay at home during the lockdown period, but there were almost 60% who did not pay any wages, did not bother about what their domestic help was doing or surviving when the lockdown was going on. Now, as I had mentioned, the National Commission for Women has been recommending for a legal review of the Interstate Migrant Workers Act 1979 to bring more impetus, to bring more focus to the issue of the issues that are being faced by the female migrant workers. They have been asking for an integrated portal for female migrant workers. You know, there are various unorganized labor departments which look into the welfare of workers in each of those departments, but they want to bring female migrant workers under one umbrella and have an integrated portal where women, irrespective of the sector that they are working in, or even if they were to move between sectors, will be able to register themselves and be a beneficiary of all the government welfare schemes. Again, you know, they are emphasizing on the implementation of the workplace sexual harassment law. Now, the POSH committees or the internal complaints committee is something that is a good initiative. It's a good beginning to make sure that there is a process for complaints that are you know, against women. But then all of us know there are so many loopholes, or there are so many interpretations of this. The ICCs are not functional at all times. The documentation of all the cases that have been raised is not there. And more importantly, the intent. It is not, see, harassment, even recently you would have seen in the newspapers or even in the news a couple of days ago about a court ruling that touching a 12-year-old girl, you know, kind of, you know, touching her breasts over her clothes cannot be termed as harassment. This is the most absurd thing that I've ever heard, because harassment is not the intent of the abuser. It is how the abused feels. If somebody feels uncomfortable merely by another person looking at them, then that can be defined as harassment. And I don't think, you know, the judiciary still has a long way to go to understand this. And so how can we blame industries for not understanding these interpretations? So documentation of all the cases, documentation of all the meetings that the ICCs have had, the different types of cases that have been brought up, what has been the ruling. Of course, when we say harassment, we don't want to restrict it just to women. If there have been cases where female workers have harassment, fine, welcome, gender parity, put it down, document it, and then, you know, we can have a case for talking about sexual harassment laws and implementation of workplace sexual harassment laws. And then definitely the women domestic help, the huge sector of domestic workers who are mostly migrant female laborers, to be brought under the purview of the Act. Making sure that equal work and equal pay is a reality, and it is not just something that is there on paper. Bringing middlemen under scrutiny, as I mentioned, agents to be completely brought under law, their scope of work to be defined, and they are made accountable. The role of labor inspectors to be tightened. When I say tightened, I think they should be empowered more. So it is not the question of them not delivering on their jobs, but to empower them more to be the guardians or the custodians of sustaining well-being in the of the migrant female workers in the industries. And all the industries must be mandated to keep a list of women and girls who are employed by them with all the welfare measures that they have been provided, irrespective of whether they were employed through a contractor or employed through an agent. And the Occupational Safety, Health and Working Conditions Code 2019, this was supposed to have all these clauses that came into it. Everything that I've spoken about in this slide was supposed to be part of the Occupational Safety, Health and Working Conditions Code of 2019, which is still you know, sitting in the parliament to be enacted. So a fast enactment of this code will make sure that all these loopholes, all these gaps that are there in the law are tightened up, and the women have kind of a more smooth environment where they can sustain their well-being. Right, there are about 18 unorganized sector welfare boards, as I had mentioned in the previous slide, wherein if a migrant worker registers themselves, they get social security, they get accident insurance, life insurance, medical facilities, and they are also given, I mean, during the lockdown, they were given cash dole and dry rations, and industries are only expected to make a very minimal contribution for registered members at 200 rupees per person per annum. And after Corona lockdown, an online registration portal has also been created for these unorganized sector welfare boards. But then in order to register themselves, they need all these a list of enumeration documentation. They need a letter from the trade union leader or the general secretary or from the panchayat or from the contractor. So all these things are required, and then they have to be verified, and then that person will be registered. So when this process is so elongated and multiple stakeholders are involved, anyone in India can understand what would be the process and how friendly or how economical it will be for the person to get themselves registered, particularly women, or in this case, even single women for that matter. Of course, if there is a registered female migrant worker, hoping everything goes well and we have a more conducive, more customer-friendly registration process, they can get dormitories, free dormitories. If they are staying alone, they get Anganwadi support for the children. And as I had mentioned, medical assistance and insurance assistance. But once the process is smoothened and streamlined, these would be available to many, many more people. So when we talk about well-being measures, we say industries should sustain the well-being of female migrant workers. So what is it that we are talking about here? So first of all, compassionate and dignified treatment. The female migrant worker should be treated at par with any other officer or any other employee in that organization. So definitely there needs to be a change in mindset when it comes to appreciating and acknowledging the manner in which they are to be treated. They should also be given the same working hours and the same pay as their counterparts in the organization who are regular employees. And then there needs to be prevention of exploitation, prevention of sexual harassment and discrimination in the organization. They should be in the living dormitories as well as in the workplace. They should have restrooms, they should have water, drinking water, safe drinking water, and hygiene absorbance should also be provided to them. Wherever possible, they should be given opportunities of continuing their education and training, because that will then motivate them better to stay and grow with the organization. There should be a modality where they can separate from the industry with ease. We see in many of these cases, there is either forced labor or bonded labor, especially in the lower rungs of the organizations. So that should be stopped, and they should be able to move freely within the economy between jobs and between industries. And definitely they should be provided linkages with government schemes. Right. So what is the expected role of NGOs after COVID? Now, in the previous slide, we saw that they gave food, they gave transportation, took care of their health, everything. So they have been more of a grantor. But have all NGOs worked in an advocacy role to advocate for the rights and privileges of the redesign themselves and move to an advocacy role in order to ensure that these rights and privileges become a reality and become permanent and sustainable for these women. The NGOs should help in creating a panchayat level registry of migrant female workers, so that there is reliable data available and is constantly updated at all times about the migrant female workers. As I had mentioned in the previous slide, they should work with female-centric organizations to advocate for a welfare board for female migrant workers, get them registered, get ID cards so that they can open bank accounts, or they will be able to take loans in case they are small vendors, or even for their own family requirements. Connect them to the ration shops and connect them to ICDS. One nation, one ration is a fantastic kind of catchword, and we think just because somebody has a ration card in their home city, they will be able to come to another city and then collect their ration from the ration shops. But in reality, it doesn't work like that. The ration shop would only get that much ration for the number of people who are registered in that shop. Merely showing a ration card is not going to help the vendor to give the food to this person. So Unless, there is this seamless registration and seamless allocation and connection of these workers to the government schemes, the people can, they can have a ration card, but they would not be able to use it. Similarly, health screening and links to, the government insurance schemes, the employee state insurance, hospitals, and so on, so that they are able to practice or they have good health seeking behavior and good health. Advocate for fair and equal wages and reasonable working hours. A single window helpline to register claims and cases and appeals for migrant female laborers. Now, they have to run from pillar to post to different departments in case they have a query or a claim. Whereas if these are brought by the NGOs under a single window, and the NGOs can be this bridge to connect the various departments with the migrant workers and then have their claims or their issues sorted, then that would be a big help as far as the female migrant workers are concerned. For those people who have not returned to the employment stream, if they can be included in the rural in skilling through the National Skill Development Corporation or the Sector Skills Council or the Deen Dayal Upadhyaya Gramin Kaushal Yojana, so that they are able to either get a skilled position or they're able to do some, they are able to become self-employed. They could set up vigilance committees to prevent exploitation and bonded labor. Basically, they could turn into these whistleblowers to bring to the attention of the government and to the media about exploitation and bonded labor. They could work with industries. I mean, we lay a lot of emphasis on what the industry should do. But unless and until the industries are trained to and made sensitized to understand what it means to provide reasonable work conditions, equitable pay, and well-being measures, the well-being will not be sustainable. So NGOs can take on the role of sensitizing industries. They could activate the internal complaints committee and make them function and document all the cases recorded. And in order to do all this, they could appeal to CSR funding opportunities that are available to address all these issues and make sure that they are done, because NGOs obviously need money to do all this work, and that money could come from CSR grants. What are the expectations from industries? Now, industries, the first point, as I had mentioned, treat migrant female workers with dignity and provide them with fair and equitable work conditions and pay, provide for all the health and safety requirements, ensure that all the complete workforce is redeployed after lockdown. Now, this is another challenge that is emerging in the industries, because as I mentioned, they are picking up younger able-bodied people and do not want to re-employ older people or people with health conditions. Now, that should not be the case. As a welfare measure for sustaining the welfare of female migrant workers, they should re-employ everybody who had been let go and make sure that their health and safety is taken care of. They should also provide non-formal education and training opportunities for better engagement and for better growth within the organization. They should support for registration with the welfare boards through giving the letters that are required through the trade unions wherever these workers are working in an organized sector. And they could also deploy, because now industries in many cases, I would say 80% of the cases, want to do direct implementation of CSR programs. They do not want to give the money to NGOs to run the CSR programs on their behalf. If that is the case, then they could make use of the CSR funds to provide various welfare measures like training, skilling, giving them better water and sanitation conditions, better living quarters, all these things, health facilities, all these can be done as welfare measures, ongoing welfare measures, because one-time grant will not come under the CSR umbrella. So an ongoing welfare measures for these workers can be done by the industries also using the CSR funds. Together, I'm confident that we can sustain the well-being of female migrant workers post-COVID if industries, NGOs, academicians, and budding development professionals such as yourself in the audience, as well as the migrant workers themselves, understand their rights and privileges of the female migrant workers, and then come together as a society to sustain the well-being of this group. So I'm at the end of my presentation. Thank you so much for listening carefully. I see a lot of questions. So, is someone going to be calling the
Yes,
questions,
yes,
sir?
yes, madam. So
Okay, thank you.
it was
Can I
a
just
very
drink?
wonderful session.
Can I just drink?
Yeah, please, please.
Thank you.
Yeah, you should. Yes. So very elaborate presentation and a lot of insights you gave through this presentation, and it shows how much you are involved into the cause of this migration and their empowerment. Running short of time, I would like to ask some important 2 or 3 questions maximum.
Sure.
One is how far the recently amended Maternity Benefit Act is welfaring this migrant women. That's what is the question.
It's a very good question, but then we do not have adequate data to show if every single organization has started giving these benefits. Definitely, those workers who are in the organized sector are getting these benefits of 6 months of paid leave and then surety of employment when they come back. Of course, they would have again now because of this new government regulation that everybody, irrespective of where they are having their deliveries, must be registered with the government. Make sure that every single pregnant woman is kind of enlisted and the government is connecting them into the welfare schemes by providing them with nutrition. And once the baby comes, they also give them all the kits. Unless and until you're registered with the government, you can't even get the birth certificate of the child when the child is born. So this is working well for those who are the organized sector. As far as the unorganized sector is concerned, the yawning gap is the lack of data. So because the first loophole that the industry states is 50, only if there are 50 full-time employees that are available and they have worked for 180 days, would they be eligible to claim maternity benefits. So very often, this becomes that, it becomes that gap in the law where industries don't provide the maternity benefits as they should be provided. But over and above that, if the person has come through an agent, at least through a contractor, if the contractor has employed 50 women, then the contractor is bound to give them that maternity benefit. But if that person has come through an agent and the law says, as if the person comes through an agent, then neither the industry nor the agent is responsible, then, it's anybody's guess if the industry is actually giving them that benefit. If the industry has a very humane, compassionate outlook, then probably yes. Otherwise, in most cases, maybe no. So maybe it would mean that the woman drops off the employment stream, and only gets back either when she finds someone to take care of her baby, or when she is able to come back in a manner that there is a daycare center or an Anganwadi that's available where she can safely leave the child. But then the Anganwadi story is an entirely different story. Because we are short of time, I don't want to go into that, because we build a lot of toilets in Anganwadis. And when we go there, they say that, in most toilets, even in Chennai city, there are most Anganwadis don't have toilets. And they say if the child wants to actually pass motion, she is sent with an assistant to her own house to go and pass motion, because there is no provision in the Anganwadi center. Imagine taking a child, like if a small child of 2 or 3 years, multiple times, and there's nobody at home, and it's anybody's guess about what is the well-being that is being offered. Yeah.
Yes, yes, madam. There are a few more questions, but since we are running short of time,
Yeah.
The next person is waiting.
Sure.
I would probably people can share their questions to us, and we can share it with you.
Yes.
Maybe if there is another occasion, you can address those questions.
Definitely.
So at the outset, I would like to sincerely express my gratitude and thanks to you, madam, for accepting our invitation. It was very easy to get your acceptance, and you said immediately okay. And the session was really tremendous with a lot of commitment. You have prepared, and you shared all your experience, how you work with migrants, and all the very best for your career. Hope to get in touch with you for the future programs, madam. Thanks a lot.
Thank you so much. I would also like to thank all of you for patiently listening, and good luck for the remainder of the sessions. Thank you so much.
Thank you, ma'am. I now request our beloved Assistant Professor, Mrs. Lisa Ilengo, ma'am, to introduce the speaker for the 4th session.
Am I audible? And am I audible?
Yes, ma'am. Yes, ma'am.
Okay. So, good afternoon to everyone online. I'd like to start by appreciating and wishing Dr. Arakiraj and his team for running the show successfully with all eminent speakers and very great participants. And here I am to introduce a very good speaker. I'd like to start it with an quote. If your actions inspire others to dream, learn more, do more, and become more, you're a leader, says John Quincy Adams. So, as the quote says, here I am to introduce a very inspiring leader, a women leader, especially Miss Lata from Sacred Heart College. She is working as a college counselor, Tirupattur. Miss Lata has completed her MSW and MPhil in Sacred Heart College, and she has specialized in youth development.